So now we're going to talk about the accessory organs and the colon. The accessory organs secrete their products into the duodenum. These include the liver, gallbladder, and pancreas. Excuse me. So the liver. The liver is the largest gland in the body, weighs approximately 1.5 kilograms, and it lies under the diaphragm and occupies most of the right hypochondrium and part of the epigastrum, or the epigastric region. The liver is the only organ in the body that can regenerate up to 90% of its mass. So if you were to cut out part of the liver, about 90% of what you cut out will grow back. Looking at the anatomy of the liver, we have the hepatic artery, the hepatic portal vein, and we have the right lobe, the left lobe, and then there's the caudate process in the back, and the caudate lobe, and the quadrate lobe. Underneath the liver, you'll see the gallbladder. The functions of the liver. The liver is the main hub of metabolism. All of our proteins, carbohydrates, lipids are all synthesized and processed in the liver. Many of our nutrients are stored in the liver. The liver plays a role in the metabolism and detoxification of alcohol, drugs, hormones, insulin, and growth hormones. It produces and regulates triglycerides, phospholipids, lipoproteins, cholesterol, acetyl-CoA. It plays a role in protein metabolism, non-essential amino acids, functional proteins, transferrin for the transport of iron, lipoprotein for the transport of cholesterol, globulins for immune function, albumin for econic pressure. That's huge. So this is your major blood protein, the albumin, and that's for osmolarity of the blood. It stores all sorts of different vitamins, and it also makes bile. So what is bile? Inside of our red blood cells is hemoglobin, and inside of hemoglobin is a heme group. And if you degrade that heme group, you're going to release the iron, which is going to be recycled, and then bilirubin is eventually produced. So first you produce biliverdin, and then you produce bilirubin. This bilirubin is yellow in color. And if the liver is doing its job properly, the liver is filtering this out of the blood and dumping it into the gallbladder. The gallbladder is going to store that bile and then stimulate its release into, or just have synchronous release, of the bile into the duodenum when we consume fats. So the liver makes the bile, the gallbladder stores it and releases it into our digestive tract. In neonates, there's usually a large amount of hemolysis that happens, especially if there's a mismatched blood type between the mom and the baby. But just the process of birth and going through the birth canal and the separation from the mom, the separation from the placenta and so forth can lead to an increase in hemolysis in the newborn baby. Also, babies' livers can tend to be on the immature side. So, the liver has a difficult time keeping up with the production of bile. Now, bile has to be stored in the gallbladder and then it has to be dumped in the digestive tract. So the baby's got to poop in order to get rid of the bile. So you have to stimulate the baby to poop. And how do you stimulate the baby to poop? By feeding the baby. Well, if the baby is trying to nurse, like breastfeed naturally, and they're not getting enough food from breastfeeding, that can also kind of cause confounding issues with the elimination of bile. So you got to get baby to poop, which means you got to feed them more. If this isn't regulated and baby isn't pooping properly, isn't eating enough, that bile can start to accumulate and the baby will develop jaundice. Jaundice in high enough concentrations can cause permanent and irreversible mental retardation in the baby, and it can eventually cause death. So this is something that has to be monitored and taken care of after birth. But outside of neonate jaundice, jaundice can happen in anyone that's having liver failure. It's one of the liver's major functions to produce that bile. So if the liver is not filtering the bilirubin out of the bloodstream, it's going to start accumulating in the tissues. So I talked about jaundice. Prehepatic jaundice happens before the liver, so there's something causing this breakdown before it hits the liver. Hemolysis, unconjugated bilirubin, and infants, so that's the prehepatic jaundice. Posthepatic jaundice happens due to something that happened after it left the liver. So obstruction, conjugated bilirubin, pale stool, and dark urine are usually symptoms of this. Obstruction is usually due to some type of stone, like a gallstone. So here you can see the association between the liver, the gallbladder, and the pancreas, and how they all dump into the duodenum. So, the purpose of bile is to emulsify fats. You can break the bonds of fats, but it's kind of like if you ever had a bottle of salad dressing, and there's oil and water in the salad dressing, and when you mix up that salad dressing, it all kind of bubbles together. But if you let that salad dressing sit, all of the fat molecules are going to come back together, and the oil is going to go to the top, and the water is going to go back down to the bottom. So those layers will eventually separate from each other, and the fats will come together again. That's exactly what happens when our digestive enzymes, lipase, break down the bonds of lipids. It temporarily breaks the bonds of the lipid, but the lipid can always come back together, unless you have bile present. What bile does is it emulsifies the fats. It keeps those fat molecules separated from each other so that they can't come back together. So, what you do, or what your body does, is when your duodenum senses that fat has entered into the duodenum, your gallbladder will release a large concentrated dose of bile into the duodenum at the exact same time that fats have entered. That way, as the pancreatic lipase is breaking down the bonds of the fats, the bile is there to emulsify the fats and keep those fat molecules separated from each other. So, gallstones, cholecystitis. So cholecystitis, or gallstones, there's 4 different types. There's cholesterol, pigmented stones, mixed stones, stones with calcium content in them. But those stones can accumulate inside of the gallbladder. And when they're in the gallbladder, they can cause blockages. And that can cause inflammation and insane pain that's usually in the center or sometimes in the right upper quadrant, and it irradiates through to the back. And the pain is so severe that the person absolutely has to go to a hospital. And in the hospital, they'll do a quick little ultrasound and see, yep, there's gallstones, and then they have to have their gallbladder removed. A person that doesn't have a gallbladder has a decreased capacity to digest fats, so they have to watch their fat consumption in their diet after they've had their gallbladder removed. Remember, the gallbladder, or the liver, makes bile, but the gallbladder stores and concentrates it, and then releases it at the exact time that you have fats enter into the duodenum, so that those fats can be broken down and remain broken apart. If you don't have a gallbladder, then you have a slow and steady trickle of bile. It's not concentrated, so you can still break down some fats and keep them separated from each other, but because it's not concentrated, you decrease your ability to digest fats. So here shows a fat globule. Lipase is going to break apart the fat globule, and then the bile salts are going to emulsify the fat globule and keep those fat molecules separated from each other so they don't come back together. And this is the chemistry of bile. And those bile acids, or bile salts, those are going to make up a big component of what bile is. The pancreas. So the pancreas lies beneath the stomach. It's grayish pink colored gland, 12 to 15 centimeters long, runs from the duodenum behind the stomach to the spleen. There are two different types of tissues in the pancreas, the endocrine and exocrine tissues. The endocrine are in the islets of Langerhans, and these endocrine tissues produce the hormones insulin and glucagon. We talked about those hormones and that function of the pancreas way back when we talked about the endocrine system. The exocrine function has acinar cells, and they're going to secrete the digestive enzymes in a bicarbonate-rich fluid. Recall that the stomach has acid. So hydrochloric acid lowered the pH of the stomach, and that acid is going to start pouring into the small intestine. The pancreas releases bicarbonate, and bicarbonate is going to neutralize the acid that's coming out of the stomach. So as soon as it hits here, the whole pH environment changes, and there's different enzymes that are activated at different pH levels. So here are some of the hormones that are produced, the cells that produce them, and what they do. Glucagon is produced by the alpha cells, and it increases plasma glucose. Insulin is produced by the beta cells, and it decreases plasma glucose. Know those two for sure. Somatostatin is produced by the delta cells, and it decreases insulin, glucagon, gastric, and pancreatic secretions. And pancreatic polypeptide is produced by F cells, and it decreases the rate of food absorption, intestinal motility, and increases gastric and intestinal enzyme secretion. The proteolytic enzymes. So the pancreas produces digestive enzymes that can break down every type of nutrient. There's proteolytic enzymes that are going to digest proteins. Those include trypsin, chymotrypsin, elastase, collagenase, leucine, aminopeptidase, carboxypeptidases. These are usually produced in an inactive form and only get activated once they get into the duodenum. Lipolytic enzymes like lipase and lecithinase, those are going to digest lipids. The carbohydrate digesting enzymes, including pancreatic amylase, and then several different types of nucleases. This is a picture of the different types of cells in the tissue and the acinar cells, how they're in a different type of tissue in the pancreas. So the chemistry of digestion in the small intestine. So in the small intestine, 3 digestive juices are secreted: bile from the liver or from the gallbladder, the pancreatic juice from the pancreas, and then the intestinal juice from the small intestine, and they break down all of the major types of nutrients. So going back here, like I said, most of these enzymes are secreted in an inactive form, and they're only activated when they get into the duodenum. So they're produced in an inactive form here, and when they're secreted here, that's where they get activated. But sometimes those enzymes can get activated inside of the pancreas. That's what causes pancreatitis. So pancreatitis is an activation of digestive enzymes inside of the pancreas. When that happens, it starts to digest away pancreatic tissue. It causes local inflammation, which is extremely painful. The patient's usually sweating, has left side pain that radiates through to the back. And this has a very strong link to alcoholism. So patients that are chronic alcoholics tend to suffer from pancreatitis often. And it's an ongoing issue that has continuous flare-ups. Basically every time that the person excessively drinks, they're going to develop that pancreatitis again. Other causes of pancreatitis, though, include gallstones, or stones that are going to block these ducts, and that prevents the enzymes from leaving the pancreas, and then they get activated inside of the pancreas. The appendix. The appendix here, and it serves as kind of a reservoir for beneficial gut bacteria. It's kind of a lint trap for the bad guys. So as bad guys try to go back up into the small intestine, they get blocked by the good guys that are hiding here. You can live without an appendix, but you're prone to increased intestinal infections. And then the large intestine, so the initial region is the cecum. Then you have the ascending, transverse, descending, sigmoid, rectum, and anus. The major function of the large intestine is the absorption of water and the production of vitamin K. And vitamin K is produced by the bacteria that live in the large intestine. Vitamin K is necessary for blood clotting. This is a picture of the inside of the rectum. So then you have these rectal folds or the rectal valves. You have the internal anal sphincter and the external anal sphincter. So the external is here, internal is here. As feces moves toward the internal anal sphincters, it's going to push on the internal anal sphincters, and then the external anal sphincters are going to contract. And they're going to remain contracted until it's convenient for the person to defecate, and these are under voluntary control. So the external anal sphincters will then be voluntarily relaxed when the person is wanting to defecate. So again, the large intestine primary functions are going to be absorbing water from the undigested food. Haustral contractions cause churning, peristalsis, and mass peristalsis, and that's going to drive the contents of the colon into the rectum. Bacteria in the large intestine convert proteins to amino acids. They break down amino acids and produce some B vitamins and vitamin K, and they help form feces, and the large intestine is responsible for defecating or emptying the rectum. So now that we've gone through the entire length of the intestinal, or the digestive tract, I want to talk a little bit about a summary here. So carbohydrates, proteins, fats, and nucleic acids are broken down in different parts of the digestive tract. Carbohydrates are broken down initially in the mouth by salivary amylase and ptyalin. This enzyme is largely now just called salivary amylase. Carbohydrate digestion continues in the small intestine. So we have carbohydrates broken down in the mouth and in the small intestine. Proteins are broken down first in the stomach and then in the small intestine. And proteins are really the only thing that's digested in the stomach. Fats are predominantly broken down in the small intestine. Although we do have salivary lipases, which you can see up here, those fats are going to come right back together when they get into the stomach. So they are truly digested when they get down into the small intestine. Nucleic acids, similar type thing. Although there's enzymes here to digest the nucleic acids, a lot of times that digestion is meaningless. True digestion of the nucleic acids happens in the small intestine.